So my name is Rakia Fick, and I'm the Communications Director at the Canadian Association of Physicians for the Environment. We're very happy to have you joining us today for a very exciting panel discussion about COP and the important implications for climate action in Canada moving forward. So I'm just going to start with I'd like to just start this our session today by recognizing that we're all calling in from different parts of Canada, which is traditional territories of many Indigenous nations, and we are deeply indebted to the stewardship that they've shown since time immemorial for these lands, and continue to fight for their rights to continue stewarding the land. I personally am calling in today from Ottawa, which is the traditional territory of the Algonquin Anishinaabe Nation, unsurrendered, unceded territory. And CAPE as an organization, that is both staff and physicians, are based in many different Indigenous lands across the country. I want to just a couple of kind of technical things. So we will have a Q&A function. So we are a large group today. So we're going to ask people as your questions arise to type them into, there's a specific Q&A function, which you'll find if you kind of click on the more button, or you might see it at the bottom of your screen. And you also have the possibility to upvote questions as well. We may have the chat enabled for introducing yourselves, and if not, just you can use the Q&As for asking your questions. So with that, I'd like to just introduce our fantastic panel of speakers today. So we have Dr. Joe Vipond, who is an emergency room physician and is CAPE's past president. We have Robb Barnes, who is the climate director, and Dr. Courtney Howard, who is also a previous president of CAPE, is currently chair of the territorial committee. And Courtney, I realized that are you an emergency room physician? I realized actually maybe you can, you're a physician. So the chat should be working now, so feel free to introduce yourselves in the chat so we know who's joining us today. And with that, I'm going to turn over. Oh, I want to also, just say a big thank you to Maria Granados, who has joined us today from Reclimate to be supporting with the text. So we're very grateful for her support. And with that, I'm going to turn over to our first presenter, which is Joe.
Well, thanks for having me here today. It's really, really exciting. I am coming to you from Calgary, Alberta, home of the Blackfoot, Kainai, Piikani, Tsuut'ina Indigenous peoples, as well as the Stoney Nakoda and Treaty 7. I'm just going to bring up my slideshow, which I've actually presented before, and I presented it live. And it's the intent is for it to be a quiz show, so an interactive quiz show that you can mentally think through the answers to these questions, maybe get a little bit of knowledge retention in by getting your brain neurons moving, and feel free to score yourself. There are 19 questions. See how many you can get. When I've done this live a couple weeks ago, I handed out candies, but I haven't figured out how to do that virtually to the winners, to the right answers over the internet yet. So that'll have to come in a different iteration. A little bit of conflict of interest. We're always taught in medicine to always announce your conflicts of interest. So I am fully divested from oil and gas. Most of my investments, due to my my RSP, are all in climate-friendly projects and stocks. And feel free to judge me on that. You can decide whether that influences what I'm saying or whether I'm just walking the walk. So let's get into the questions. So first, what is the Conference of the Parties? Is it A, a trade show, B, global negotiations, C, many parties, or D, a greenwashing extravaganza? And because we don't have a lot of time, I'm not going to give you much time to think between those answers going up. And the answer is...
Joe, we just need you to try sharing your screen again.
Oh, it didn't work. Going backwards. Is that working?
There we go. We can see it.
Sorry, everybody. There's my title show. There's my conflicts of interest slide. There's our quiz. And there's the answers. So the answer is all of the above. It's been going on for 28 years. Initially, it was really just global negotiations where the parties, which is officially the governments of around the world, got together to try and do an international treaty on climate. And then as time has passed, it's turned into a trade show. There's lots of companies as well as governments and subnational governments hosting pavilions at the event. There's many parties, which also transforms to networking. It's a gathering of some of the best minds from around the world, including a lot of Canadian minds that care about climate, and that's really empowering. And it's also becoming a greenwashing extravaganza, as of course many of the attendees are now oil and gas. How many years has Canada had a pavilion at COP? So A, none, B, 2, C, 10, and D, 28. And the answer is 2. We've only had a pavilion for 2 years, and it's really become an important gathering place for Canadians. Not only are there events held there, like seminar sessions, but it's also a gathering spot. There's coffee, so free coffee is always an attractant, and it's a place where people can meet and chat, and it's been really important to have that space for Canada. How many people attended COP28? A, 3,372, B, 38,457, C, 49,704, or D, 83,884. And the right answer is the last one. Those are all real numbers. The 30,000 number is from Paris in COP20. Getting it right? No, COP21. And then the 38,000 was the next big one. There's a big one every 5 years. So the next big one was in Glasgow for COP26. And then even though they're supposed to be really only big every 5 years, last year or 2 years ago at Sharm el-Sheikh, it was 49,000. And then amazingly, this year, the official stats are 83,000. And there's quite a bit of controversy as to whether we should be gathering that many climate people in one spot, having to fly around the world. 83,000 is a lot of people. There's a lot of GHGs that go into that, but it's a fraction of the flights that occur every day. And of course, I really think there's a value to gathering people in the same space and allowing them to interact. You cannot do a lot of the things that are done at COP virtually. What areas of COP are there? A, the green zone for the public, B, the blue zone for delegates, C, the red zone for fossil fuel lobbyists, and D, the purple zone for animal and plant delegates. And of course, the right answer is A and B. I really wish there was a purple zone for animal and plant delegates so that they could have a voice, but alas, they don't, and so we have to speak for them. And I do believe that it'd be nice to have a red zone where the fossil fuel lobbyists are sequestered away. They finally this year had tags that identified them as fossil fuel lobbyists. I believe they were a pink color, but they can circumvent that by attending under a country delegation. So say you're an oil and gas company from representing an oil and gas company from Saudi Arabia, you can be there under a Saudi Arabian country badge and you can hide under that. But there certainly is a green zone for the public and a blue zone for delegates. The blue zone is for people that have accreditation and allows you to go in there. That's where the negotiations occur. There's lots of things, lots of public activities going on in the green zone as well. For instance, Saskatchewan had a pavilion in the green zone this year, as well as a lot of other companies. How many years in a row will COP be held in authoritarian states? A1, B2, C3, or D, never? That'd be undemocratic. And the right answer is 3. So Sharm el-Sheikh was in a military dictatorship of Egypt. Last year was in the sultanship of the United Arab Emirates. And next year is going to be in the autocratic state of Azerbaijan. And 2 of those 3 are actually oil and gas petrostates, that being the UAE and Azerbaijan. And so I really worry about this, why this was allowed to happen. I know that Azerbaijan, part of the reasons why it was picked is that Russia, it needed to be in the Eastern Europe next year, or this year, I guess. And Russia refused to allow any states that were supportive of Ukraine in their current war to host. And so Azerbaijan popped up to the top. What other position does Sultan Al Jaber host other than COP28 president? A, head of the Abu Dhabi National Oil Company, B, Minister of Industry and Technology, C, president of the Abu Dhabi Future Energy Company, or D, winner of the 2008 Olympic silver in high jump? And the answer is, well, 3 out of 4. The Abu Dhabi Future Energy Company is the renewable company that's in Abu Dhabi, in the UAE. And so a lot of people say, well, at least there's that. But he also happens to be the head of one of the top oil and gas companies in the world, and has been very criticized for that conflict of interest that is involved in him being in the presidency. How many oil and gas lobbyists attended COP28? None, that'd be a conflict of interest. B, 503, C, 636, or D, 2,456. And incredibly, the answer is D. Those other numbers are real too. B is from Glasgow, COP26, and C is from Egypt, COP27. And we were like astounded that there were 600 people at Sharm el-Sheikh for COP26, and yet quadruple the number at Dubai. And of course, I think that really speaks to the need to have a counter voice. They're there for a reason. They're there because they want to influence the negotiations. And so that, for me, makes it all the more important that I attend and that I try and draw attention to some of these problems. What is the main civil society organization at COP? The Climate Action Network, the Climate Kickassers, the Canadian Association of Petroleum Producers, or D, civil society is not allowed in the gates? And the answer is the Climate Action Network. So Climate Action Network International is a collection, a network of organizations around the world, predominantly country-based, that work together to push forth a civil society narrative at COPs. And so, for example, in Canada, we have an organization called CANRAC, which is Climate Action Network Réseau Action Canadien. And that's the Canadian version of that. And they're an entity unto themselves. They do amazing work, and I'm so proud that CAPE is a part of their work. Which prominent Canadian politicians attended COP28? Danielle Smith, Scott Moe, Justin Trudeau, or Stephen Guilbeault? And the answer is 3 out of 4. So I think it's pretty evident that Danielle Smith and Scott Moe were not there to further the climate negotiations. They were there to basically argue for the status quo and put forth the messaging that is supportive of the narrative of oil and gas continuing from our countries. There's a definite bent to the talks that they were at, which we're going to get into. And Stephen Guilbeault was there announcing policies, and actually I'm quite proud of where we're at with some of the policies that have been announced. And we can get into the controversies as to whether they're enough or whether they're too much, but at least we were there pushing forward as a nation. On December 5th, the province of Alberta won which award? The Nobel Peace Prize, Fossil of the Day, the United Nations Following the Science Trophy, or the UAE Fellowship Award? And the answer is the Fossil of the Day. So this is a Climate Action Network initiative where every day countries, sometimes multiple countries, are announced as fossil today for their actions to impede, to weaken the climate negotiations. It's very rare for a subnational to get this award, but through the advocacy of CANRAC, Alberta incredibly got it about midway through, and they got it for a number of reasons, but for attending COP and trying to impede the action, as well as for the renewables moratorium that was put in place in August of this year. There's so many reasons why we won. Canadian Oil and Gas purchased a pavilion under which moniker? The Canadian Oil and Gas Pavilion, the Clean Resource Innovation Network, the Unicorn Farts and Fairy Dust Pavilion, or the Carbon Sequestration and Net Zero Celebration Pavilion? Well, it could have been all four. Actually, they're all accurate, but the actual answer is B, the Clean Resource Innovation Network. I just want to point out the absence of a couple words. There's no Canadian in that title, even though it was explicitly a Canadian endeavor. And there's no oil and gas. It actually sounds quite beautiful, right? The Clean Resource Innovation Network. And they were there right next to the OPEC Pavilion, and right next to the International Nuclear Agency Pavilion, arguing for basically a lot of carbon sequestration and net zero efforts. And I'm not sure if we're going to get into it today, but I have concerns that neither of those things are real and probably would deserve the monikers Unicorn Farts and Fairy Dust. When was the first climate conference? When was the first climate conference to have a health day? A, COP1 in Berlin, COP12 in Montreal, COP21 in Paris, or COP28 in Dubai? And the right answer is, wow, COP28. So pretty late to the party to have health on the agenda. But it was through the efforts of a lot of doctors and other professionals behind the scenes that we actually got this through this year, and it was quite a celebration. And I do think it's really important to have health as a frame for the climate discussions. Who are the key players in health and climate? CAPE and the CMA, the WHO, the Global Climate and Health Alliance, the Rockefeller Foundation, and Wellcome Trust. And the right answer is all of the above. So CAPE has been there for, I think, since Paris, and Courtney was the first CAPE attendee and has been there, I believe, every year since, and representing Canada. The CMA is pretty new to the scene, but they sent the president this year, as well as the policy specialist on climate. The WHO has, of course, been on the scene forever. The Global Climate and Health Alliance is the key group, the network of health organizations that care about the climate around the world. And I'm actually quite proud to say that Courtney Howard is the vice chair of that organization, and I'm a board member. And I think it's really important, the work that they're doing. And finally, the Rockefeller Foundation and the Wellcome Trust, two of the biggest funders in the world on health and other social efforts, arrived on the scene this year to push things forward as well. How many countries have signed on to the Declaration on Climate and Health? 1, the UAE, B, 47, C, 143, and D, 197. And the right answer is 143. So we're not quite at the whole world, which would be 197, but that's pretty amazing for our first COP to have a health day. And the declaration, I think, is really important. There's the one notable absence of calling out fossil fuel emissions as needing to be phased out, but I think it's really important that we have this strong group of countries that care about health and that have signed on to this. And I think it's actually a little higher than 143. It's been ticking up since the end of COP. How much money was pledged to support climate and health action at COP28? 100 million, 500 million, 750 million, or $1 billion? And the answer is $1 billion. So this will be really important to help decarbonize our health systems, especially for those developing countries, as well as make them more resilient against the climate events coming down the pipe. What key fashion accessory was launched at COP28? A, the climate jersey, B, the climate crisis warming stripes tie, C, the emissions cap, or D, the follow the science t-shirt? And the answer is the emissions cap. A bit of a play on words. This was created in order to draw attention to the fact that Canada needs an oil and gas emissions cap, and that we're one of the first countries in the entire world that produces substantial oil and gas to make an effort to limit the emissions, the greenhouse gas emissions for oil and gas. Which key policy did Canada reaffirm and expand on with the US at COP28? The USMCA, which is the free trade agreement, the softwood lumber agreement, the hockey draft rules, or the methane reduction plan? And the answer is the methane reduction plan. We had previously agreed to decrease our emissions by 2025. I believe it was by 50%. Now it's been reaffirmed to go by 75% by 2030. And this is really important because methane is a really, really important greenhouse gas. It's 80 to 85 times the greenhouse gas potential of CO2 molecule for molecule, which means if there's any fugitive emissions within the system, so leakage in the system beyond 3%, and that can be anywhere from abandoned wells, active wells, pipeline, storage, transfer between storage and LNG, shipping of LNG, anywhere in there more than 3%, and it negates the climate advantage of methane over coal. So this is a really important policy that I think we need to focus on. Which key climate policies were announced by Premier Smith at COP28? A, ha ha ha, you're joking, right? B, zip zilch, not a zero, not one. C, CCS is the best. Or D, unofficial climate delays in policy. And of course, they're all correct. There were no actual positive climate announcements by the province of Alberta at COP28. What language was used in regards to fossil fuels in the official text of COP28? A phase down of fossil fuels, a phase out of fossil fuels, we need more fossil fuels, or a transition away from fossil fuels? And the right answer is a transition away from fossil fuels. It's pretty incredible to me that we're at year 28 of these events, and this is the first time that fossil fuels have been mentioned in the COP text. Shameful, actually. Some people think it's great that we're finally at that stage. I think it's akin to talking about the fact that water is wet in a rainstorm. Like, it's so self-evident that I don't think we should be celebrating doing the bare minimum. But that being said, I do think there are the need for these kind of big events, and I'm glad that we're finally starting to talk about the root cause of the climate crisis. So I think I have to reshare my screen because I need to. I got to share sound because now we're going to. Can you see that? Am I still on the slides?
No, you'll have to just go and select which the appropriate tab. Just try it
Sorry
again.
about this. Try that one more time. Can you see it now?
Perfect.
Okay. So one of the things that I did at COP28 to try and draw attention to the greenwashing that's going on is I created this Debunction Junction events. They're little 1-2 minute videos on Twitter to draw attention to some of the greenwashing that's been going on. And I'm just going to go to that right now. And we'll try and play this, see if it works. Welcome to today's Debunction Junction. Today we're looking at the Clean Resource Innovation Network. They've got a booth behind me. You can probably see there's an event going on there right now. Even though the word Canada is not in the name, the word oil is not in the name, this is distinctly a collaboration of Canadian oil and gas. I think it's quite interesting that they're not being upfront with who they are. I also think it's quite amusing that they weren't able to get space in the Canadian Pavilion, which is generally the place where these kind of events should be taking place. And I think it's further a little sad to see how few people are there. There's the guy that's sitting in that booth is actually one of the staff. I don't know about who else is in the room, but there's essentially more people on the panel than there is in the room.
I don't think this is a good use of Canadian oil companies' money. I think they should be putting that money into decarbonizing, getting off fossil fuels, but instead, welcome to the COP. And we'll just bring it down to there.
So yeah, if you search the hashtag Debunction Junction, you'll see the remainder of those. And then that is it for my slideshow. Those are some of the ways you can reach me, see some of the work that we're doing. And I'm looking forward to the discussion later on in our presentation.
Thanks so much, Joe. I learned something and I also laughed along the way. So much appreciated. I'm going to be turning over to Robb Barnes, the climate director at CAPE, who's going to talk us through a bit more about some of the big announcements that came out of the COP and their implications for Canada going forward. So over to you, Robb.
Thanks, Rakia, and good afternoon, good evening, everyone across the country. Great to have you here. It's so great to have such a good crowd of folks engaged and interested in the presentation. So I've got a bit more of a heavy policy focus slide deck for you. So I'm gonna see if I can pull this off. I will click on share screen and then slideshow. Please let me know if you can see the first slide.
Yep, we see you.
Great. So I want to talk a bit about the basics on COP. I know Joe covered a bunch of really interesting facts, and I'll hope to further contextualize a little bit about what COP means, especially as it's evolved into what's now COP28 going on to COP29. So folks know this was held in Dubai. This was a late COP going into December. So some COPs are more important than others, right? In the sense that some are expected to yield a landmark outcome or agreement. COP28 was not one of those. These other names, Joe mentioned Paris, Copenhagen, Kyoto. These are some of the big ones. Dubai was not expected to be one of those, but nevertheless, some of the results were surprising, I think, surprising in a good way. As Joe mentioned, a record number of attendees, and folks are coming from all places, right? Joe mentioned some of the controversy around the idea that 80 something thousand people descend on a city for a couple of weeks. And, over the course of COP, we heard some ideas batted around. There was a Canadian editorialist, I think it was in the Globe and Mail, mentioning, oh, maybe we should just have a policy-focused COP in Bonn, Germany, and we can have a civil society one and everyone else in another city. And so, these are ongoing debates and discussions, but all this is to say it was a point of focus and a point of, surprise for many, just how many people are interested in COP. And as Joe mentioned, this is the first one to include a thematic day focus on health. The other piece that you might read about if you're learning about COP28 is this thing called the global stocktake. This is clunky UN language for a check-in on climate commitments, the status of climate commitments. And a lot of the text, the final COP28 text, is in the global stocktake. So happy to share that with folks if you're interested. It's where we get a lot of this language that I'll touch on later around the outcomes of the COP agreement. So I've heard bureaucrats refer to COP this way, and ever since I've started using the same expression. It's a three-ring circus. So at the core, there are the negotiations. So you have, the serious business. These folks are highly trained, often in law, and they're senior public servants. They're all engaging in negotiations, often high-level officials, presidents, prime ministers, et cetera, come in for the final, cut and thrust of a text discussion, as in the case of Copenhagen or Paris. They're the party announcements. So these are bilateral or multilateral agreements. Big organizations are sometimes founded at COPs, things like the Powering Past Coal Alliance or Beyond Oil and Gas Alliance, multilateral, organizations. And then there's civil society and all the rest of it, right? And I guess into civil society, we can even lump, private sector actors now too, who aren't really civil society, but are often participating in the same spaces as civil society. So these are two shots of the Saskatchewan Pavilion, which was in the green zone this year. The green zone is where civil society normally congregates. And on the left, actually, it's just a little bit of a shot. You can see Saskatchewan advertising its potash in Arabic on the metro of Dubai, right? So it's become a really interesting international forum where, you know, subnational governments, national governments, everyone's kind of competing for space, trying to become the dominant narrative or a dominant narrative among many, many, many threads happening. This is a bit of the Canadian context. So a large Canadian delegation, and my point of reference is often, my first COP was 10 years ago under the Harper government. The delegation is now much larger under the current government, and that's a notable, you know, change if you just take a kind of 10-year snapshot. Not only has COP grown, but also Canada's involvement. And I think there are real questions as to what might happen if the government changes again. Will we see the same level of engagement? I would say probably not. You've got the minister, you've got staffers, public sector employees. We've got a chief climate negotiator. Minister Stephen Guilbeault, as Joe mentioned, he's a COP veteran, and he kind of runs circles around many of us. He's been to pretty much every one of them. So he demonstrates a really comprehensive understanding of the system mechanics. You're the person across the table in many cases has, you know, very, very deep experience and understands the system and is therefore able to leverage it. Some engagement from parliamentarians. So for those who know Elizabeth May, no surprise, she's also at all the COPs. Senators have shown interest increasingly over the years, Galvez, Coyle. This year, I didn't, if folks might correct me if I'm wrong, but I didn't see any NDP or Conservative MPs, and also no Liberal MPs besides the minister. So it remains, again, this being not a quote unquote important COP, you're not going to get the attention of, let's say, the prime minister or presidents, et cetera. So it remained not a huge showing from Canadian parliamentarians, but as Joe mentioned, there's a new development for 2023, and something that's very interesting going forward is the presence of Alberta's premier and Saskatchewan's premier. And the idea that the provinces would send representatives is not new. Ontario, Quebec, the territories have sent representatives in the past, but never quite like this, never in an oppositional role to the best of my knowledge. And I defer, of course, to Courtney, who has tons of COP experience and might have some corrections when she presents. But this is my understanding of the status. So we're seeing a combative relationship within the federation, and we're seeing it play out on the international stage. So a little bit more of the Canadian context. Canada was the host of COP15, not to be confused with the other COP series. So there's a bunch of biodiversity COPs and then a bunch of climate COPs. So COP15 was a biodiversity COP held in Montreal, originally slated to be held in Kunming, but moved due to the pandemic. So it's the Kunming-Montreal COP, essentially. And Stephen Guilbeault is trying to make linkages where possible, really around nature protection, tying the nature protection, outcomes of the global biodiversity COP to the climate COP. Second year in a row, as Joe mentioned, where Canada purchased and operated a Canada Pavilion to showcase its priorities in action. And what you're seeing with the Saskatchewan Pavilion is essentially a counter reaction to that. You're seeing Saskatchewan say, our narrative isn't being represented at the Canada Pavilion. Therefore, we're going to purchase our own space for $750,000 and send the premier over and basically have a competing narrative. And so it's interesting in that sense. And I don't think I saw anything quite like that, with the U.S. states, for example, where the states are competing against the kind of federal or national narrative. Last year, the government did receive pushback for its inclusion of the Pathways Alliance at the Canada Pavilion. For those who haven't heard that term, that's a broad umbrella group representing Canadian oil and gas industry. And so as a result, they're also off at their own pavilion. In fact, two, really, they were very, very active at the Saskatchewan Pavilion, as well as the Crin Pavilion, which was in Joe's video. So what was announced at COP? Well, a few things. It's increasingly a prominent space for climate policy announcements. If you talk to bureaucrats in the summer and you ask them about what's happening on climate files, as I often do, they'll say, well, we're all getting ready for COP. This is the big space where there will be big policy announcements that can complement the international negotiations. So, an example of the domestic policy announcements, we had the announcement on methane regs and emissions cap, which I'll cover shortly. Bilateral or multilateral announcements. So when the methane regulations were announced, they were announced within the context of something called the Global Methane Pledge, which is a multilateral pledge to reduce methane emissions. And of course, the Powering Past Coal Alliance is actually an entire organization that was spun out of a previous COP, a collaboration between United Kingdom and Canada to basically phase out coal internationally. And then there are these international pledges, the Climate and Health Declaration. Sorry, I just jumped a slide there. And other similar declarations where all of a sudden you'll have 150 nations across the world sign on, and some big announcement at COP, as there was in the case of the Climate and Health Declaration. So here is a clip that you see John Kerry. Those of you who know about John Kerry, who ran for the presidency a little while back on the same stage as Stephen Guilbeault on the right, and this is around the methane announcement midway through COP. So what happened with methane? Well, Canada had in place an existing oil and gas methane commitment. And here I should specify, these are methane reductions for the oil and gas sector, right? As opposed to agriculture. There are different targets for different sectors. This is just exclusively focusing on oil and gas. And of course, reductions were pledged to 40 to 45%. And if anyone's interested, I can forward much more detailed information on any of these files. I'm just going to kind of skim over them. But generally, methane reductions are a relatively popular climate policy measure. They reduce near-term warming. There was some discussion in the chat about, how much global warming potential methane has over different time periods. But basically, you get a lot of bang for your buck, really, in terms of reducing warming. And then also, some of the measures actually save industry money. So there's an incentive for industry to come on side, because often what they're doing is leaking methane through a variety of channels. And what you're asking them to do is essentially increase their efficiency at the same time as you're reducing methane. And so, there's a kind of a wide spectrum of political actors that are often in favor of a methane commitment. And I think, like coal, what we saw is some initial methane commitments, and then some greater ambition and some appetite for greater ambition. People realizing it's one of those rare climate stories where we were doing better than we thought, so we decided to scale it up. And this is the we here being the international community. The health dimension on this piece, as many folks on this chat know, it's a little under-researched, I think, in parts. Just recently read a meta-analysis on it, and it's evolving very quickly. And CAPE recently was involved with sending a letter about the health impacts of oil and gas emissions to the Prime Minister and others. So Canada was on track to exceed its original methane targets and was expected to raise the level of ambition, and so we did. They were announced on December 2nd. So now all of a sudden the target jumped from 40 to 45% reductions to 75% reductions. And then the other piece that was interesting was this idea of funding for a methane center of excellence. The idea here is that we very commonly underreport methane emissions. There's a lot of fugitive emissions, a failure to correctly track where our methane is being emitted. And so the Methane Center of Excellence was a proposal to basically better capture that data, better fund the analysis and collection of information around methane leaks. And so that was partially funded. It wasn't a full victory, but some promising moves on methane. And there's Courtney at a scrum on the emissions cap. This was probably the biggest domestic climate announcement there. Someone in the back sporting an emissions cap, but you can't really see it because it's so zoomed in. It just looks like a blob of white. But in any case, the emissions cap were a very hot fashion item at COP28. So what is the emissions cap? Well, this is a long promised cap on greenhouse gas emissions from the oil and gas sector. Long promise dating back to the 2021 Liberal Party election platform. Hotly anticipated. Maybe it makes it sound like a really fun movie or something. It's just a bunch of regulations, but as you might imagine, the very nerdy climate community of which I'm a part gets very excited about regulations like this. And so they've been hotly anticipated and delayed for years. And we're now actually entering a period of risk for successful implementation. The idea being that, there's a good chance that this minority government will fall within the next year and a half. And there's an increasingly risky, scenario where the emissions cap regulations are brought in, but not fully implemented in time before an election occurs. So CAPE and others in the civil society, really other climate groups, have been calling for reductions in line with Canada's overall economy-wide reductions targets. And what did we see at COP28? Well, we saw a framework. So note that these are not regulations, but Minister Guilbeault and the government used the COP space as an opportunity to make an announcement about the emissions cap, basically like a prelude to the upcoming regulations. As you saw with the picture of Courtney and others, we were invited to a media scrum with the Government of Canada. And, you know, it's often, you know, with any one of these policy announcements, you're going to have pros and cons, right? So there's a question about, you know, how meaningful was the emissions cap announcement? And so I'm going to give you the classic economists, you know, answer on the one hand, on the other hand. So Canada was the first oil and gas producing country to announce a cap on oil and gas emissions. That's great. There's an understanding going in that Canada has limited room to maneuver because they can only cap emissions and they can't cap oil and gas production. Production is under provincial authority as per the Canadian Constitution. So there's a degree of stringency that the emissions cap can't exceed. So understanding the kind of ground rules, there's still a lot to applaud. Canada was the first to do something like that. And just a note on the constitutionality piece, for those who've been following climate files, there have been a few recent setbacks in the Supreme Court on how far Canada can actually go to legislate some of its climate commitments. On the other hand, the framework targets of the 35 to 38% reductions from the 2019 levels basically aren't as strong as what we were asking for, and basically don't meet the mark in terms of what civil society has been demanding for some time. And as noted, you know, the framework is not the regulations. So we still have that challenge in terms of, you know, the speed of implementation. There's still this really huge sense of urgency among the climate community and concern that we might not get the regulations in time. And then if you read, of course, as with all these policies, the devil's in the details. So if you read through it, you'll find some rather interesting and exotic offset mechanisms, which basically dilute the overall effectiveness. And so right now, a lot of the fight in the climate community is around getting rid of some of those offset mechanisms so that the emissions cap can be as robust as possible. So it's an ongoing conversation, an ongoing debate, but COP was the kind of the forum for that announcement and the forum for that initial discussion around emissions cap. And so there are more opportunities for engagement and modification. Stay tuned. I know many of you have been very active with CAPE's invitations to send letters to your MPs and the minister, et cetera, outlining different asks around the emissions cap. So just a few other developments before I wrap up. Canada signed a declaration on climate and health. We saw significant progress on something called the Loss and Damage Fund. Happy to go over that in terms of what it means, but basically helps the hardest hit areas dealing with the impacts of climate change. And we saw some unexpectedly ambitious language in the global stocktake. And you might have seen some of these in the headlines coming out of COP28. This is the transitioning away from fossil fuels line. There's another line around tripling renewable energy capacity globally by 2030, doubling the global average annual rate of energy efficiency. Those were hard fought, hard won. And note that contrary to some claims, I've heard from some corners people saying nuclear was prioritized also by COP28. It wasn't really prioritized. It was treated, the key term there in that quote is inter alia, among others, right? So it's one technology among others that was seen as having potential for accelerating zero and low emission technologies. But that was just another kind of interesting takeaway from COP. It was kind of a technology neutral declaration in the global stocktake. Again, happy to answer questions as we move towards the end. So with that, just a picture of me with the happy dinosaur from the Fossil of the Day Awards. Thank you very much. And I'll pass it over to Courtney. Well, first Reiki, then Courtney.
Thanks so much, Rob. That's great. I just want to remind people that if you have a question that you would like the panelists to address, there's actually two functions. There's the webinar chat and there's a question and answer, Q&A. So if you could put your questions into the Q&A function, not the chat, that will help us to track them and answer them more smoothly. So that would be great. With that, I'm going to turn over to Dr. Courtney Howard, who's going to be speaking a bit about some of the big health developments that came out of the COP. So Courtney, thanks so much, and over to you.
Thanks so much. And hello to everybody. I'm in Yellowknives Dene territory. This is the traditional territory of the Yellowknives Dene and the North Slave Métis, as well as the Wallade Dene. I have lived here for 12 years now, and really the North is where I started to learn about climate change and health about 15 years ago when I was a resident in Inuvik. And I wanted to just situate us within where we are with regards to Mother Earth, this complex self-regulating system that we walk around on every day, because I know it's on everyone's mind. And I want to connect it in with what we do here in Canada and also up in at COP. Some of you know I did a policy degree last year, and I learned that the word for what we do is a multi-level game. So basically the idea is to have the work we do in our communities aligned with the work we do at the national level via CAPE and the regional committees, aligned with the work that we do internationally, and to create feedback loops of increasing ambition between all of those to help us create natural, social, economic tipping points to counteract the scary ones in the Earth system. So just at this moment, really, this is a race. We're at a moment that's a race between us triggering socioeconomic tipping points before the natural tipping points take hold. And so to just go through this a little bit, if I were speaking to you in person, I would ask you to put up your hand if you were familiar with the concept of tipping points. But essentially, you know, we talk a lot about the negotiated outcomes of the Paris Agreement, you know, the fact that we're aiming for 2 degrees Celsius, no more than 2 degrees Celsius of global surface temperature warming, aiming for 1.5 degrees Celsius. And I think we haven't done a very good job of explaining why those are targets. You know, here, like, is that just a politician who decided that? Why? Now, for me, as an emergency doctor, I spend a lot of time trying to stabilize natural systems, these complex self-regulating systems that we walk around in every day and that we think about every day when we're seeing patients. And I think that that really translates to the way we can think about the Earth system at this moment. And so essentially, we're aiming to decrease our drivers of greenhouse gas emissions before we start positive feedback cycles within the Earth system that trigger its tipping points and bring it to a place where we can no longer really control what happens. So these are some of the tipping points that we talk about, ice sheets, the permafrost that's actually under my house right now, et cetera. You can see up in the left-hand top corner there that a lot of them are at risk between 1 and 3 degrees Celsius. And analysis since then has really sort of put 1.5 degrees Celsius as the threshold beyond which we really need to start to worry. So this is a concept that has come really from sort of the depths of IPCC report to a big section in this year's World Economic Forum risks report. So this risks report gets a ton of media coverage. I mean, it is what the world's policymakers take a look at in the early part of the year. And this was covered really comprehensively. And in fact, was partly based on the work of someone named Tim Lenton, who also led a global tipping points report that was released right around COP. And in that report, he actually said that we're now so close to hitting some of these natural tipping points that triggering socioeconomic tipping points and governance strategies related to those is really the only way that we're going to be able to keep from hitting these natural tipping points. And I think what's so exciting is that the health community is really, I believe, one of the most likely communities to help to lead this work on some of these socioeconomic tipping points. Now, it turns out that when we model natural systems, we almost never model humans in there, which is hilarious. Like, I think enough of us have sort of witnessed errors in systems or in the hospital that it's hard to surprise us anymore with regards to human blind spots. But really, it turns out that, you know, we don't get modeled into climate systems very often. And when we are, what it shows is that we can play a definitive role. And this is a super, super complicated diagram. But what it basically shows is that work at multiple levels that's aligned can create economies of scale and policy feedback loops that can have definitive effects translated into the natural climate system. So why do I think that the health community is important to this? Well, we have reason to clean up our act. So greenhouse gas emissions and air pollution associated with healthcare itself are incredibly noxious. So study out of Harvard a couple of years ago quoted that fossil fuel related air pollution really it triggers it's responsible for almost 1 out of every 5 global premature deaths. So anything we can do to decrease fossil fuel related air pollution saves lives. Some of that actually comes from healthcare. Now we're responsible for about 5% of global greenhouse gas emissions. That's more than shipping and aviation combined most years. So this is not inconsequential when you think about how often we talk about people getting on a plane. And we allocate, and this is really interesting, 10% of global world product as a global health sector. So you can see that when you think about, you know, money talks, we have a lot of ways if we organize ourselves to really make a big difference. So with this thought in mind, a couple of years ago, I convened a group of docs from around the world, multidisciplinary group, in fact, to say, okay, so given what's already known about social tipping points, what things that the health sector already does, can we amplify? Can we do more of to try to hit these tipping points? And so these are the things that we came up with. And some of you may have seen this previously, and I just want to refresh your memory to show you how we're now implementing it. Because really, we have list after list of things that need doing. But if we don't get them done, it's just a nice idea on paper, right? That's living on PubMed somewhere. And so the implementation, I think, is the kind of fun bit. So we're now at a place where, you know, we used to be trying to get people to learn about climate change and health because the Lancet told us to. Now, people are being met by climate impact and patients walking through their door, whether that is somebody needing a puffer because they're exposed to wildfire-related smoke, whether it's an elderly patient who is having real trouble during a heat emergency. These people are coming into healthcare facilities, and our colleagues and us are feeling worried. But, you know, we say, well, why wouldn't you change? Well, there are real structural barriers to change and interpersonal barriers to change. And we need to recognize the role of both. So social norms matter and structural norms and supports matter. So one of the first things we have recommended is taking an oath to bring this into practice, and best if done in a group, because what happens then is you're actually changing your social norm immediately. So then if anybody has another initiative, they're much more likely to have the courage to be able to bring it forward. When I first started this work, my first question when I finally found my people, this was 15 years ago, was how do you come up with the courage to do this work? Because I was pretty lonely at the time, and it was terrifying. I'm a shy person fundamentally, and I had never gotten up and presented a motion at an annual general meeting. I was scared to get on the phone with policymakers, et cetera. And we need to support one another, not minimize that fear, and figure out how we can just lower the barriers for people. So these are some of the main things that we have come up with. And so what happened a couple of years ago at COP26 was we came up with a sign-on. And so this was as part of work with the WHO working group that I was on at the time on behalf of CAPE as part of the work with the Global Climate and Health Alliance. And we said, okay, so we're going to help the WHO develop a sign-on for climate resilient low carbon health systems. And we're all going to try to get our countries to sign up before COP. And so what happened was such a social event. So Nick Watts, who is frankly a brilliant strategist, was in charge of Greener NHS at the time, and managed to get a zero emissions ambulance ready in time, like the day before, to go park it in the parking lot at COP. And so now when you think about visual communications, we have this beautiful, shiny vision of the future to use to motivate people. And so we were bringing politicians through there. He had a lovely paramedic who helped to design it, who was showing people how ergonomic it was. And so what happened was that instead of having maybe 9 countries sign up, at the halfway mark of COP, the US committed publicly. And all of a sudden it just went like this. So what we really saw was that you can have races to the top, just like you can have races to the bottom. And it's these races to the top with a clear decision point and peer pressure amongst countries and a time limit that have time and time again worked. So that happened at COP26. We completely exceeded expectations, came home, and now Canada is on the hook to try to deliver on our own commitment. And so we've been working on that slowly here in Canada, but I have to tell you, it was an incredible moment for me to go to the health ministerial this COP and see country after country after country saying what they were going to do to deliver on these commitments that they just made 2 years before. So I walked in and Nepal was saying, well, you know, we've just baselined our national health emissions and this is our plan to reduce. Can you imagine? You know, sometimes we have the feeling that nothing that we do matters. I can never think that anymore. It absolutely does matter. These were words that I didn't hear coming out of anyone's mouths other than my close friends until about 48 months earlier. And here we are, or 2 years later. So this is huge. So you think about what's happening here in terms of norm shifting, right? So now we've moved from the micro level, individual level, we're moving up, we're creating change in our communities that's visible to our entire communities. We're starting to shift pretty big budgets. And we are doing this on an international level. Shifting the money associated with divestment is a very important part of this. And the exact same thing happened with the Fossil Fuel Non-Proliferation Treaty. And so this is a big part of it because shifting norms around fossil fuels is one of the sort of tipping points that's been identified. And CAPE's work on ad bans is a really, really important part of that. Like, what a beautiful, clear ask, fun and creative campaign. So this is part of that as well. It's an easy commitment to make. And what we saw when we started to lead this last year, right before COP, was that the more countries and organizations signed on, the more everybody felt safe to sign on. And so the more people signed on, to the point where the WHO felt safe to sign on. And what we heard from the treaty folks was that it was after that the countries started feeling safe to sign on. So this is something, like, this started with a meeting with Sephora Berman the year before. I'm proud to say the coordination was led by the Global Climate and Health Alliance. The Global Climate and Health Alliance only has a secretariat of about 5 people. Like, when you start to organize this giant sector, things start to move. So the opportunity is that we shift 10% of gross domestic product. And that starts to shift investment decisions. That starts to make decision makers decide, okay, well, maybe I have the social license to make a different, more ambitious choice here. And we have the opportunity to fundamentally shift towards happy, healthy families and a rapid low carbon transition. And so what we're doing now in Canada to try to action this on the micro and meso level is we led by some very smart and committed champions within academic medicine last year, Geneviève Moineau and Julien Poitras from Laval. They said, hey, we want a sign-on for the medical school deans because, you know, many of us have been trying to get curriculum change in medical school since 2009. Like, it's been a long time and it just hasn't worked. And it hasn't worked because we've essentially had medical students and junior people trying to brief up to more powerful senior leaders who didn't know what they didn't know and therefore didn't think it was important, never put it on the agenda, and continued to not know what they didn't know. And so what's happened now is this went out at the dean level. Again, time-limited sign-on, peer-to-peer pressure. They had to get it done by a conference that happened about a year ago. 16 out of 17 medical schools signed on. And so now they're all trying to action it. Other countries have watched this. And this is us. So now this has happened in Canada. And so now we have to deliver on it too. And part of it is climate resilient healthcare. And so while we're at COP, we're each having our own adventure. It's kind of like going to a wedding. You know, you come out of a wedding, everyone has their own story about what they were doing at the wedding. Well, I was trying to get people at Health Canada on board with this, as well as getting the international community on board. So this is work we're doing at the Health Canada Pavilion with Health Canada, with the Canada Pavilion, with Health Canada, talking about this, helping them understand that we're seeing this in our communities, which is why I was wearing my stethoscope. And the stories that we can bring from what's happening to our communities to these high-level areas are so powerful. So, you know, many of you know that Yellowknife was evacuated last year. Our 100-bed hospital had to be evacuated to 2 provinces. Thank you to everybody who hosted a northerner or who rounded on a northern patient when they came to your hospital. I mean, it really took people from all over Canada to help. And so what Will Gagnon and I did was we wanted to bring that storytelling because we know that stories stick. It's good to back up with numbers, but it's important to tell the stories as well. You know, part of advocating on behalf of our patients. So we brought this to the World Health Organization Pavilion and told the story. And to be honest, it was actually quite difficult. It took us a whole day to put this together. It wasn't a long presentation, but you know, you're dealing with the grief of it. You're dealing with the knowledge that, you know, we may be approaching tipping points. So not to minimize that work, but also realizing that speaking from the heart, bringing these clinical stories to these spaces allows us to have impact and sway in a really, really powerful way. Part of that involves then bringing those clinical stories to the spaces where people who don't get to see patients anymore very often are. So Dr. Maria Nair, she's the head of the WHO. Many of the women in this room were incredible change makers, but they invited me because I can speak to the front line, the national level, and the international level. And so back to the health ministerial, you know, we've talked about relationships. And, you know, people ask me, why do you go? You know, is this okay for a person to even go? Reality is that everything we need to do right now is we're asking people to make change. Change is scary. We make scary change when we trust the people who are asking us to make that change. We're humans, our physiology developed around the campfire, it developed through storytelling, it developed through touch. I really think that we're ignoring what we know about physiology and behavioral change and trust and relationship building if we try to tell ourselves that we're going to be able to do as good a job at a distance. We simply are not. And so if we leave that skill set and that set of tools to the fossil fuel industry, we're going to show up definitely. And I mean, that's why they pay their lobbyists, right? They know it works. So if the doctors stay home and the fossil fuel lobbyists go, we are definitely going to lose. Like that, I know for sure. And so going and forming these relationships and helping one another develop skill is exactly what allows you to put on a day like this. This Amia, the co-chair there, Amia El Amrani, she was one of the International Federation of Medical Students Association reps on the Global Climate and Health Alliance board several years ago. So this is someone that I've watched come up from this like glowing little medical student. And now she was co-chairing a health ministerial. Similarly, you know, it matters to have Tedros know who you are, because then the next time you see him, it's more likely that he will sort of be interested in what you have to say. And he sits at tables all around the world. Meanwhile, the changing face of leadership, I think, is really interesting to note. So this is Dr. Loujain Al-Khalmati. She's the current president of the World Medical Association. That day that I showed up at COP in Paris, she was a medical student, again, an IFMSA rep. She arrived to give the keynote at the beginning of this health ministerial as the president of the World Medical Association with her daughter. So think about that. Think about all of the visual signals she sent with that, all of the relationships, all of the time in these spaces that went into her being able to do that. You know, there's skill built in these spaces, relationships built in these spaces that when translated from the international level back to the national level and back again, just create massive change. So the Global Climate and Health Alliance, we're a tiny organization, but because we speak within the health frame and we know from communication studies that that's the most effective frame. Our messengers are trusted messengers who are community embedded, can bring those stories from the community at the front line to policy tables. We really have had a disproportionate impact already. And I mean, I can't even imagine what would happen if we could even triple our funding. And so because this back and forth is so important, the Canadian work actually on the Declaration of Planetary Health was really seen as helpful by the international community. They wanted to bring this sign on into their countries and their spaces. So right before COP, we published this invitation to do exactly that with Lou Jane, with some other international colleagues. And I was able to present that with international different types of health professionals. There were nurses, pharmacists, social workers on this panel, and they were excited about it. We'll bring it back to their country. So you can see the different types of inspiration that are possible, the different types of leading by example, the different types of learning courage through watching other people's courage, and the different types of community building that are really part of this. So is it perfect? No. Is it the whole picture? Absolutely not. Is it a critical picture? I really, really think so. And it's just been so wonderful to have more people there. Rob is an incredible organizer. He gets us to the right place when we need to be there. Joe, basically, if you put Joe somewhere with a blow up globe and a doctor's coat, essentially media from all around the world just descend. You can't go anywhere with him. It's like going somewhere with a toddler. So it was an absolute joy to be there with the CAPE team. I'm really glad to be here to chat with you about it, and looking forward to questions.
Thank you so much, Courtney. Thanks to all three of you for your presentations. We're moving into the Q&A portion of our evening. Rob has helpfully answered some of the more technical questions in the Q&A chat. So feel free now to go ahead and put your questions in. I think if it's all right, I'm going to kick off the discussion with a question put to the three of you about what are the next months look like from the campaigning perspective, from CAPE perspective, coming out of this COP where there's these exciting announcements made, but still so much ambition needed. Where do you see the campaigning priorities?
Maybe I can take a quick stab at that one. So for folks who are unaccustomed to the regulatory process, both methane and emissions cap are regulatory processes, and they're moving through a fixed set of processes. And as mentioned, emissions cap isn't yet even moving through that. It's a framework that was announced. So the regs proceed in two pieces: CG1, in which they're announced. Then there's a bunch of edits and modifications, and then CG2, usually something like a 60-day period or 75-day period after CG1, they're finalized. So methane CG1 is out. CAPE has sent comments. Over 500 CAPE healthcare practitioner supporters have co-signed a letter as part of that input process. So we're hoping to see some tightening of the methane regulations on the basis of that input in CG2. On the emissions cap, it's I think a much bigger file. In fact, the methane regulations kind of feed into some of the emissions cap. We're going to be campaigning, kind of ringing the alarm bell on all sorts of aspects of the emissions cap. In particular, the speed at which it's implemented, the stringency of the targets, as well as eliminating some of these carve-outs and offsets. So stay tuned for opportunities there. It's an ongoing piece, and it won't necessarily just follow the government rhythm. There'll also be, hopefully external events, more webinar opportunities, all sorts of places where people can plug in.
In regards to the international sphere, COP is kind of the culmination of a whole year's worth of work. There's always things going on behind the scenes. There was just an IPCC conference that was, I believe, last month. Then we go into the World Health Association Assembly, and that's late May. In June, there's the Bonn negotiations, which is kind of the prelude to the COP negotiations, and that happens in Bonn every year in June. In September, there's Climate Week, which is focused in New York City, as the head of the UN is there, and then we get back to COP28. So there's COP29, sorry, in Azerbaijan. So lots of activities going on all behind the scenes that kind of culminates in that November event. The GCHA will be at most of those. CAPE, not so much. We focus most of our efforts on the national sphere.
There's another question specific to the Declaration on Climate and Health, and whether there are any good opportunities enabled by that declaration that can be leveraged by our group and others or others. Courtney, did you want to take that one?
Sure. So like any document that has had 1 million people edit it, the declaration wasn't as strong as what we would have liked to have seen. And so essentially everything Kate does is more or less ahead of where the declaration is at. I think the significance of the declaration, though, is just in connecting climate change and health, because we know that it is the most motivating frame. There's been so many communication studies across the world, across the political spectrum, that have said once people understand this isn't about the polar bears, they understand this is about their child and whether they will be safe and healthy and have food to eat and have stable health systems. It's a different order of magnitude of motivation. And so I think that what that declaration did was it got that message out to audiences within the mainstream policy world that we really, really needed to access. And so what we would like to see is we would like to see more health ministers come to COP. We would like to see more structures built within governments that make it much easier and even required for health ministers and environment ministers and infrastructure ministers and everybody else to be making plans that take all of this into account with a planetary health or a climate change and health lens. And so for me, that was about just like straightforwardly mainstreaming climate change and health, getting it into all of the policymaking spaces, but also dragging the health ministers. We've been trying to get the health ministers to COP for ages. And of course, there's conflicting priorities. We take care of people with all sorts of other problems, but the problem is that a lot of senior decision makers and senior leaders within academic medicine, within our health system, still don't know what they don't know. They have zero clue that we're not at a new normal. Like every single time I'm in a big room and I say, we are not at a new normal. Canada is going to continue to warm until at least mid-century. Every face in the room goes like this. What that tells me is that they haven't made their evacuation plan for their hospital based on the precipitation projections and the temperature projections that are coming. They're still, most disaster medicine in Canada is still done without a climate change lens. And so what we're trying to do is integrate all of that so that everybody who's sitting at a table knows what's coming and is preparing for it. And I think that's what the declaration is starting to do.
I think the health frame is really important because it is, as Courtney says, it's that connection between the human and the climate. And, somebody asked me, how are you actually going to make people change? And I can't remember who it was who mentioned it, but I really nailed it on the head. We're going to do it through love, because really what motivates people to change, it's not caring about polar bears or frogs or forests or even other people in other jurisdictions. We really, really are a little bit selfish as a species, and we care about ourselves and those that are around us. And so this health frame makes people understand that this is really something that they need to do if they are going to protect those that they love. I look at the people in my neighborhood and all the efforts that they do to make sure their kids are in the right schools and go to the right universities and take vitamins every day, because God forbid they, miss their vitamin D one day. And they do that because they care and they want their kids to have a good future. Well, this is just taking that to the next level. So I'm really hopeful that we will use our connection to health and to climate to make people understand that it's not a game. It's not who can one up the other, who can bring the most lobbyists to an event. It's really about how do we protect the people that we love.
So we're starting to get more questions into the chat, and since we're kind of we still have time to answer them, but I'm start kind of grouping some together. So we have a couple specifically around fossil fuel interests and lobbying. So the first is what can be done to decrease conflict of interest at future COPs with regards to fossil fuel interests within selected host nations and attending lobbyists. This undermines trust in the process. Conflict of interests in IPCC reports also seem to be increasing, likewise undermining trust. I'm going to put forward another question around fossil fuel interests, which is a little bit different, but maybe they can kind of be answered. So I've appreciated COP taking on the oil and gas industry, such as health implications of gas stoves in kitchens. I think the oil and gas advertising phenomenon is so damaging, and you are doing great work there. I believe there's a bill before Parliament related to this. Is CAPE involved, and what role are you playing to forward this now? Obviously, good progress happening. Thanks. So, putting to our panels.
You know, sometimes I hear people say that we need to engage the fossil fuel industry in these discussions because they're such a huge component of our economy, and they're such a huge responsibility on this issue. But they've never really shown themselves to be honest actors, right? Like, not once. There've been short-term attempts like Beyond Petroleum for BP that have been basically scuttled as soon as a new leader comes into play. You know, we've seen Enbridge and other Canadian oil companies buy wind farms and solar plants, and only to sell them again and to refocus their efforts on their core industry, which is oil and gas. And to be fair, they make a shitload of money on oil and gas, and so they don't want to be distracted by all these saving the planet things. But yeah, until they can prove themselves to be honest actors, can show that they understand their responsibilities in fixing this and start to move those forwards, I just don't think they belong at the table. So but I know that's controversial.
I'll just jump in. I've really found the new and emerging literature base on the commercial determinants of health to provide a really useful frame. And if people are looking to learn a little bit more about this, the Lancet put out a really great series last spring. And so what they do is they just sort of systematically take a look at tactics everywhere from research to influencing guidelines to lobbying to public narrative, just common tactics of all of the different corporate interests or commercial interests that influence health. And so whether that's food or tobacco or fossil fuels or pharma, I found it super helpful to read through that because you can see they're all using the exact same tactics. And so once you realize that, then it's a lot easier to come up with a corresponding set of tactics that we use and to systematically start to take the game plans that worked in tobacco and bring them over to what we're doing with fossil fuels, or the things that have worked in food and bring them over. And so, you know, something that has, and I emailed Millie about this earlier today actually, is so our former Minister of Health, Jane Philpott, one of her broadcasted achievements was the food guide. So the food guide was developed. Basically, she put up her sharp elbows and she said, we are not going to have food and beverage lobbyists in the closed door sessions with people developing the food guide. And I was, I think, president-elect of CAPE at the time, and I did our policy submissions. I went to the different input sort of meetings. I met with the person who's running the process several times. I heard from everybody. I heard from him. I heard from other people at Health Canada, that our submissions were incredibly important in terms of sort of advancing the rationale for a plant-rich, planet-friendly, people-friendly diet, but also that Jane Philpott was an actual hero in just not bending to all of the demands on her to let them in. And in fact, they tried to lobby around her by going to other ministers, the agriculture minister, et cetera. And that's what they had to do. She was just like, no, the people who ran this said it was the most inspiring thing they had seen in their entire career. And we ended up with an evidence-based food guide because of that. If you take a look at the food guide from before and the food guide we ended up with, it's night and day. And meanwhile, it looks exactly like the Eat Lancet Commission report that came out at the same time. And so what I learned from that is that it is possible to create policy in a way that minimizes influence from industry actors. And we should be using that same type of tactic for the fossil fuel. In fact, we recommended that in our Lancet Countdown policy brief from about 2 years ago. So I think we need to just be super systematic in analyzing all of the different ways they're influencing things, coming up with a counter tactic putting our resources to where that is most effective, and being really, really having a power lens on the way we're approaching things, more than this sort of pretty darn naive academic approach that we've taken to this point. We're too smart for that. There's a lot of evidence to show that it doesn't work at all. And we need to be actually very aware of the game plan of the fossil fuel industry and developing a game plan of our own that is as aware of power, is as aware of money, and is as targeted in terms of policy making.
Just to follow Courtney's point and to tie some of the questions I saw in the chat and the Q&A together. So there were questions around, I think the question was something around how sustainable is this for CAPE to attend COPs, but there's a broader question that we all often ask ourselves in civil society, which is like, is COP worth it, right? And then there's connecting that to the oil and gas question. So you know, when we talked, you know, Courtney, when we first chatted back in Egypt at COP27, you know, there's a pragmatic efficiency argument for attending COP, which is that you get more meetings in like a 10-day span with such access to high-level officials than you normally would in like a 6-month period. So that's like one piece. But I think the more important piece is around being present in some of those spaces, especially making sure that, you know, the oil and gas industry, for example, is held accountable. You know, thinking back to the last COP and the fact that the Pathways Alliance was at the Canada Pavilion, and then advocacy worked and they were not in COP28, I mean, that's like a night and day difference. And, you know, where Joe was filming that Debunction Junction, that was in like the basement corner office of COP28. Like, so things change, and they change because of advocacy and because of the presence of, you know, groups like CAPE, but also understanding that there are entire networks of folks like all the people on this call who are supporting these organizations and putting pressure on domestic politicians. So, I mean, there's no easy answer to say what to do with oil and gas, but don't be alarmed at that growing number of oil and gas lobbyists. It might be a kind of plea for help in their case, and maybe a plea for desperation, the fact that they're sending so many people to COP because they've just realized that it's a really important forum to be there. Luckily, I don't think media and government is buying a lot of their spin, which is why we're seeing increasingly high-level, you know, interventions from premiers, for example. So I think we're winning. It just takes a while to you know, to see the end result.
Can I just put a plug in for our fossil fuel ad ban campaign that's been going on for about a couple of years, and you may have noticed that about 10 days ago, it was put forth, a private member's bill was put forward by Charlie Angus to actually codify fossil fuel ads as misinformation and not being allowed to broadcast that. And man, the repercussions from that was crazy. There was lots of noise, lots of, oh my God, the premier weighed in, the NDP of the Saskatchewan and Alberta weighed in. You know, people were tearing their hair out, and that's a huge sign that we're making a difference, right? If they thought this was inconsequential, unlikely to pass, they wouldn't have even bothered raising an eyebrow. But we are raising eyebrows as an organization, and yeah, and just to reiterate what Rob was saying there. When you think about it, every single positive thing on equity, on making the world a better place, has actually come from people like you and I doing advocacy. These things don't happen naturally. They don't just happen. You have to have people knocking on doors, yelling from the rooftops, you know, writing op-eds, doing webinars on COP28. You know, that's how change happens. And so that's why I'm involved in this organization anyway.
So we're running close to time. I'm gonna kind of group together some questions into a kind of three areas, and maybe you can each choose one and spend 1 minute answering it, and then we'll be coming to the conclusion of our evening. So there's been a number of different questions that have popped up on the chat around different emission source, war, dumps, hydro dams, animal agriculture, forestry emissions. So I'm wondering if maybe kind of as a whole, you know, kind of if you have anything that you'd like to, any point you'd like to make around these kind of other sources of climate warming gases, and kind of strategies for addressing that, given that there's been quite a number of different questions on that topic. There are a couple around like future work around health. So there's one here around what could be the biggest wins related to health and climate in Canada in the coming months/years. So we did talk a bit about like what these next coming months look like, but I guess then the question would be, well, beyond that, where do you see the biggest potential? And there's one specifically around decarbonization of the healthcare systems in Canada, so perhaps including that. And then a third one is around supporting climate-related mental health resiliency. Kind of, yeah, resources and recommendations. So I'm gonna have that be our last kind of 3-ish questions. Yeah, over to you. And perhaps I'm being overly ambitious for our remaining now 2 minutes. It took me 2 minutes just to answer the questions. So yeah, we can follow up with questions that weren't answered. Maybe I'll just, we can do a quick go around and we'll have some kind of closing points, perhaps relating to those questions, or anything that's kind of pressing that you'd like to make to our 3 panelists.
I'll jump in. So the Declaration on Planetary Health is really important. Many people on this call know more about planetary health than almost anyone else at your institution. I would really encourage you to use that as a tool as much as possible, because chances are your dean has signed on, and if not, any health system leader would, I think, now have the social license to do so. It has action items in it aligned with what we need to do to push over tipping points. And right now, what I'm doing, I have a contract with Health Canada, talking to a bunch of people, landscape assessment, gap analysis, putting a plan forward for the next 5 years to lay out what the supporting structures would look like in order for us to be able to do that at pace, at scale. So please lean into that initiative. We're hoping to build the supporting structures that everybody needs. I'm excited that that's coming on board. And I think that that's what we need to help to really decarbonize the system, to help get people's hospitals ready for the next wildfire and heat season. So stay tuned, and thank you for everything you've already done to get it to where it is.
Maybe I'll quickly touch on the militarism and the war aspect of things. I think it's pretty evident that blowing things up, destroying lives and infrastructure is not a climate-friendly way of moving through the world. I personally get very afraid of the fact that we seem to be having more right-wing dictator-like people in power, and I'll call out Putin and I'll call out Netanyahu and the bad things that they're doing in the world. And we need justice for Israelis. We need justice for the Palestinians. We need justice for Ukrainians. And we're not doing. We as a species are not doing what we need to do to come together for the collective good that will allow us to beat these very existential threats. And I worry that we're going down a bad path, and the only thing that's going to stop it is people power. And so I celebrate the fights that the Ukrainians are doing to protect their lands. I celebrate the Israelis that are protesting the unjust war that's going on there, and I call for a ceasefire, like many have. I don't know. It's hard times. So hugs to everybody who's struggling through these things.
And maybe I'll just jump in on there's a lot of questions around, is CAPE looking into X or Y, Z? Please, I'd love to get to know every single person on this call. I think I put my email there once. I'll put it there again. Get in touch. If I don't have an answer for you, I almost certainly know someone who does. And whether they're at CAPE or in the environmental sector as a whole, there are often answers in terms of, is someone looking at, methane from waste? Yes, there's definitely someone. What about animal agriculture? Yes. So all across the board, I can help you make the connections and be pleased to meet you. Thanks for making the time to come out this evening.
Yeah, and just to say as well, there's also been some chat around kind of local engagement. So CAPE does have regional committees in every province and the territories other than PEI, but we're hopefully there soon. So there's lots of ways to get involved. I'm going to add as well the general CAPE email, which is info@cape.ca. You can visit our website at cape.ca as well for different ways to engage. So I just want to say a huge thank you to everyone who joined today. Thanks for giving so much time in your evening. Thank you so much to Courtney, to Joe, to Rob, and also for Maria for her technical support. Still much more to discuss, still much more action to take. So this is just one point in the journey. Thanks a lot, everyone.